Now we have the last case for the evening for the 3D surgeries of ours. We still have 2 more surgeries left, but this will be the last 3D surgery that we have for the day. This will be done by Dr. Gaurav Luthra. The patient details is like that it's a 67 years male, has both eye cataract and is planned for right eye cataract surgery. This is the IOL power calculation done by IOL Master 700, and the patient is planned for 80 Lisa toric. So the implanted IOL plan for the patient is around 18. So back to the OT to see the last 3D case for the day.
Already
I have to do a cataract?
in the
No, yeah, I'm going to do a cataract. Then I have to go to
OT now
file
is
then
on
an
table
AGV.
and it's being prepared for surgery.
I have to do an 80 laser trifocal. स्टूल को हटा लो. अब आपको आराम से लेटना है. क्लीन ड्रिप कर लो. This patient is planned for 80 Lisa trifocal. It's a trifocal toric.
Okay, so this patient is for a toric trifocal lens.
Yes.
Right.
क्लीन ड्रिप कर लेते हैं. लो मैं कर लो. कौन सा है? आपकी दाहिनी आंख बनेगी बाजी? बंद कर लीजिए. सर का ना वो सेट जो रेडी करना होगा एजीवी के पॉइंट ऑफ व्यू से नेक्स्ट वो भी रेडी कर लेना. सर का नेक्स्ट एजीवी है ना, इंदर भैया से बात कर लो. हाँ इधर ही करना है. अब आपको ऑपरेशन के दौरान ना हिलना नहीं है. लाइट में देखना होगा. ऊपर एक माइक्रोस्कोप की लाइट दिखेगी, आप बस उसके बीच में देख लेना. ठीक है. अब आप लगाना. No, 3D after this. डॉक्टर पांडव सर, हाउ डिड यू लाइक द 3D थिंग? आप भी तो वहाँ यूज कर रहे थे ना वो वाला एल्कॉन वाला.
We have the other one.
You have the Alcon one.
Yeah, we have the.
Is there any difference between the two?
I think it's the same.
Almost
Very
the
very
same.
similar. We have mostly for the posterior segment,
Right.
and this is for both.
Yes.
Posterior
So the
segment
advantage
as
in
well
this,
as
I've used that one also. What I realized is that we used that for a month or so here, about 2-3 years back. Here, you can switch. Like there are certain times when you don't want to see 3D and you want to see
Yes.
this. So you don't have to wait for it to be switched, You just have a small button, you flick it, and then you can start using.
I think that's a very big advantage.
It's a big advantage, sir.
with this machine, and also I believe there's a little bit of lag.
Lag in this is much
Yeah.
less. I use the Alcon
With
system
that
also.
system that we're using, because that's basically designed for posterior segment.
Yes, yes.
And for anterior segment, I think that
Absolutely,
sometimes
sir.
you feel that.
Yes, yes. So it slows you down a little bit.
You have to be slow, deliberately.
Yes.
Goes
So all UKSL members, whether executive or no executive, for Janna body is 7:30 in saffron leaf. And all faculty here, they are also invited for dinner and saffron leaf. 8 p.m. 8 p.m.
इसको बेटे साफ कर लो, इसमें कुछ लगा हुआ है ना, और इसका माय ग्लास मेरे क्लासेस में तो नहीं है, उसमें ही है। चलो आप उसको कर दो, मेरा तो अभी मुझे नहीं दिख रहा क्लास।
Can you hear me from the hall?
चलो ठीक है।
Dr. Gaurav, can you hear me?
Yeah, can you hear me?
Yeah.
So we were cleaning and draping this patient because this is also for 3D.
Yeah, I can see that, but we are not getting the 3D transmission.
Okay, we are just going to switch it on. We'll take a moment. Huh?
Okay. We can see you and we saw the cleaning and draping, but can't see the.
So we are just. We'll be with you in a moment. And after this, after me, Dr. Pandav is going to do the AGV, which is the most awaited. I think everybody's been talking that AGV hoga, you know. So
yeah, you haven't seen, you have been through a very perfectly bloodless surgery the whole day.
No, sir, it's different, na? And
So,
AGV is something you don't get to see.
I mean, all those who are surgeons, they must see a little bit of blood at least towards the end.
And there are residents too waiting to see that.
Right.
Thank you, sir.
इसको डाउन कर लो, बस 71 पे मैं कर लो। हाँ, ग्रेड 2। So do you have a view now?
Yeah, we can see your screen. Yes.
There's some snowing. Yeah. Okay. Better. आपको लाइट में देखना है? Registration. We are going to do a trifocal, 80 Lisa trifocal from Zeiss, and we are using the Callisto system for which is a markless system which integrates with the ILMaster 700. So while the ILMaster 700 lies in the OPD, it sends data directly to the OT, to the microscope. And this data actually now comes to 3 machines. It comes to the Artivo system on the microscope. It also comes to our FICO machine and onto this screen which I'm seeing on. So this the Cortera which we are using, it has a screen which is getting a feed. Can you show the machine? So this is a Cortera machine which is on my right. And if you can see, this is a FICO machine, but it has a display and it also gets the video feed. It gets the Callisto feed and it has a full planning station for cataract surgery. And it has some amazing things like, it has 4 pumps, which are basically, that is why it is called Cortera. And these are have a response time of 200 milliseconds. So you almost never get a flat a surge at all. And the chamber is so stable, and the cutting ability, cornea. So is the registration done? So I don't know if you can see the overlay, but we have the Callisto overlay, which probably is not coming to you.
Yes, we can see the overlay.
You can see the overlay?
Yeah.
So, as a habit, what I do is that I like to doubly sure I use another mark, based on what the Callisto is showing right now. Can you wash it, please? So that later on, suppose end of surgery or something, for some reason the overlay is not working or whatever, it happened to me once. Ever since, I just do this as a safety check. So we are all set now. And लाइट में देखते रहिए. So I use these calibrated side ports with my calibrated infusion irrigation aspiration systems, which I have devised myself, so that they are all 22 gauge. So all my instruments are 22 gauge, which go in from the side port. So there is no leakage. When I'm doing surgery, my wounds are well sealed, and even my chopper is calibrated to this. So the leaks are minimized. And this machine is amazing because I've been using it for 2 weeks now. It actually tells you how much fluid was wasted, how much was used, and I end up using just about 20-30 ml. So it is telling me to make my incision here.
Your blades are really very...
The money blades, which they have sponsored all the surgeries today, and all the surgeons have used it. Everybody has enjoyed it. They are effortless. They are better than diamond knives, and we've been using them all through today, and I've been using them for many years now, and I enjoy these blades. And here I would like to also acknowledge that all the consumables, disposables, gowns, and everything, because our OT is 100% disposable, we don't have a cloth in the OT, is all supplied by, sponsored by Bioflex people from Haryana. You know, they are doing some amazing work, including all our powderless gloves and everything are made by them and sponsored by them this for today. And I would like to acknowledge that. So doing the Rexes on the 3D system is a pleasure because you know it kind of accentuates it, and also the advantage is that you can work at a very low light. And I'm enjoying the OCT system because you know it also become very useful for our posterior polar cataracts and for our ICL patients. And if you have a DMD, you'll immediately be able to see it. So, is Dr. Neelam here? No. She could be seeing the 3D, she would enjoy it. कौन सा कैनला दिया आपने? हाइड्रो डिसेक्शन नहीं है. So I like to do a fluid wave and then I rotate the nucleus just with my hydro dissection cannula itself. My assistant today, being my regular assistant, has made a mistake and given me a different cannula, which is a viscoelastic cannula, but that's okay. So we are now going to do a direct chop, and I'm hoping that the Cotera will work as I want it to. बस अब आप लाइट में देखते रहिए. So बस ये सब थोड़ा सा सब्र रखिएगा सर. हाँ, so the posterior plate is very important. It's a NS3 kind of a cataract. Lateral separation has to be good. I'm doing a central chop and making sure that my posterior plate is cracking most of the places. Can you wash the cornea? Can you wet the cornea, please? Bas Babuji. So the hold is amazing and the chamber stability is very good. Once it embeds, it just doesn't leave it till you have completed your crack. Unlike some of the machines where you kind of have to keep grabbing it again and again, you'll see that once it's embedded and holding it, I don't have to worry about it's holding it really well. So my endonucleus is separated now. I like to do this endonucleus separation. I hope we are well centered. So the Cotera is living up to its name, and the 4 pumps, they work actively to ensure that you don't get a surge at any point. And the followability is amazing. You don't have to actually go after the pieces, they just come to you. So it's a very different pump from what all the other conventional machines use. And somehow it seems to work very well. I still haven't understood the science behind it, but whatever be the science, for us the benefit is of a very, very stable chamber.
Gaurav, you did chopping with a chopper or with a dialer itself?
Yeah, so my choppers are very, very small. Even for hard brown cataracts, I don't need a sharp or a big chopper. I'm very uncomfortable using those very big choppers. And I usually, even for my hard brown black cataracts, I just use a chopper which is again designed specially for me. And it is a 22 gauge chopper which is flattened to block out my wound when it's inside. So there's no wound leak when I'm chopping. It blocks the side port. So
Great, really. I'm Manavdeep from Delhi. Gaurav.
yes, sir. Yes, sir. I can recognize your voice. Thank you so much for being with us for so late in the evening, sir. it requires some stamina to sit in the hall till so late.
ये मैं सतांशु को दे रहा हूँ.
Gaurav, I am just to show you that I am present here. So you should not get angry with me. So I am sitting here.
I won't get
I
angry.
never sit in the hall for so long time, but because of you, I am sitting afraid of you.
And Dr.
And this is really fantastic. 3D experience in Gaurav is really very, you say, curiosity for all of us. The governor has a big praise for the 3D surgery.
Okay.
And special for our young surgeon, Narendra Shetty.
Yes.
Narendra is here, there?
No, he has just left. He's gone to the hall.
Yeah. So he was remembering Narendra name repeatedly said four, 5 times. And he was remember the patient name also, Bhattji.
So
you
can see that the cortex was gone in a few moments, and now I'm going to do a hydroimplantation.
Dynamic surgery.
Dr. Tanshu, you're sounding very relaxed today. I think so inauguration is over, it looks like.
Yeah, it is over. First inauguration is over, second inauguration tomorrow.
Gaurav, you routinely do hydroimplantation?
Yeah, 100% hydroimplantation.
So you are doing it without visco?
Without visco, yes.
So any problem you face without visco?
Not really, but right now I'm facing a problem because the chamber is not very deep.
Not in the chamber, but in the cartilage.
No, I don't face any problem.
You have injected visco in cartilage?
Maybe one drop is there because without that,
Yeah,
actually, there I saw it injected by the IOC. That is without the visco.
So there's practically no visco, sir. Actually, they just kind of put a drop so that.
Yeah.
But see, if you notice, there's no visco which came out. Normally, if you put visco in the cartridge, some visco will come out. So this lens is amazing. I've been using a lot of toric lenses from Zeiss also, and many people think that they are hydrophilic and they will not be good. But I have had a great experience. The centration and the positioning is very good because it's a 4-point haptic, and the PCO rates are negligible. Even with these 80 Lisa hydrophilic lenses, which I'm using the trifocals, I have not seen PCO. I've been using big numbers over the last 2-3 years. Most of my cases are now 3 years old or even longer.
So this is a magic of 3D that more than 50 people are still sitting in the hall.
And they are enjoying your surgery, Gaurav.
Surgery, Gaurav.
Thank you, sir. So,
Gaurav, I think it's very nice to have calibrated incision because there is hardly any wound leak.
Yeah, there's almost no wound leak and the chamber remains very stable, sir.
I think that is one of the trick of your hydroimplantation.
You see, my wound is so tight that it's actually difficult to bring in the instrument and bring it out. So, so I'm going to now seal the incisions.
Okay.
And for toric, especially, doing hydroimplantation is good because the lens remains where you leave it. If you have to wash out visco, many times the lens will rotate a little bit, sir.
But do you find it difficult or easy to put it in the right axis?
Under infusion, no problem at all because my chamber is filled, sir. It's a deep chamber, so there is no difficulty in rotation. In fact, it's easier than doing it under visco, sir. Because chamber is so big and it's kind of distended. In fact, I remember using Callisto for the first time almost 10 years back in a live surgery in PGA.
Yeah,
I'd come for a live surgery event. Light में देखिए
It's very useful.
Second OT चालू नहीं है?
सर यहाँ पे 3D में ही करना है ना AGV actually, तो अब इसके बाद सर का ही केस लग रहा है. That's the last case for the day and sir has been very patient. He's here for 2.5 hours.
Okay.
So I'm giving over to the OT to sir.
Dr. Panda sir,
So
welcome.
one thing which I feel very particular about is intracameral moxifloxacin, and I've been requesting everybody today who's operating here to please use, especially in a live surgery setting, we must use. So whenever there's a high risk situation, I use it for 100% of my patients. But for those who don't like to use it for 100%, at least for those instances where, and almost for 5 years now, I've been using intracameral moxi.
Gaurav, I agree with you. I have also used 100% moxi nowadays after repair with this research history. So there is no harm in injecting, then why we should not use it?
Yes, sir. So I think now I'm going to.
Dr.
It'll take us 10 minutes to set up sir's patient. Sir is going to scrub.
Okay, thank you very much.